The profound interplay between the mind and body has been acknowledged for centuries, yet its significance is often underappreciated in modern medical practice. As Boris Pasternak poignantly expressed in Dr. Zhivago, the toll of living inauthentically, constantly suppressing one's true feelings or conforming to external expectations, extends beyond emotional discomfort to affect physical health. Our nervous system isn't just a fiction, it's part of our physical body. It can't be forever violated with impunity. Chronic health conditions, whether severe like cancer or heart disease or more subtle ailments stemming from prolonged stress, can sap the vitality from life. To live vibrantly, we must heal not only the body but also the mind, recognizing their inseparable connection. This article delves into the ways negative thought patterns, unresolved emotional states, chronic stress, and trauma contribute to illness and disease, while also highlighting the mind's potential to foster healing and restore well-being. Drawing on insights from leading thinkers, scientific research, and historical examples, this exploration seeks to illuminate the intricate mechanisms through which the mind influences physical health. Modern medicine, with its focus on biological and chemical explanations for disease, often overlooks the psychological and emotional factors that play a critical role in health outcomes. By examining phenomena such as the nocebo effect, medical hexing, chronic stress, maladaptive emotional processing, and the lasting impact of trauma, this video aims to provide a comprehensive understanding of how our inner world shapes our physical reality. Through this lens, we can better appreciate the power of the mind to both harm and heal, offering a pathway to greater empowerment and holistic well-being. The idea that the mind and body are distinct entities is a relatively recent construct, rooted in the mechanistic worldview of modern science. However, as Carl Jung eloquently argued in Psychological Types, the distinction between mind and body is an artificial dichotomy. In fact, so intimate is the intermingling of bodily and psychic traits that not only can we draw far-reaching inferences as to the constitution of the psyche from the constitution of the body, but we can also infer from psychic peculiarities the corresponding bodily characteristics. This perspective invites us to view the mind and body not as separate systems, but as a unified whole, two facets of a single phenomenon that are deeply interconnected. This unity is evident in everyday experiences that most people intuitively recognize. For example, a stressful day at work might manifest as a tension headache, a racing heart, or a sense of physical exhaustion. Similarly, prolonged anxiety can disrupt digestion, leading to conditions like irritable bowel syndrome, while chronic stress is known to weaken the immune system, making us more susceptible to infections. As physician and author Gabor Mate observes in The Myth of Normal, there is nothing novel about the notion of the mind and body being intricately linked. If anything, what is new is the belief, tacitly held and overtly enacted by many well-meaning doctors, that they are separable. This artificial separation has led mainstream medicine to prioritize biological and chemical treatments, often neglecting the psychological and emotional dimensions of health. Neuroscientist Candace Pert, in her book Molecules of Emotion, reinforces this perspective, stating, "I've come to believe that virtually all illness, if not psychosomatic in foundation, has a definite psychosomatic component." Pert's research on neuropeptides, chemical messengers that facilitate communication between the brain and body, demonstrates how emotions and thoughts trigger physiological responses that can either promote health or contribute to disease. By ignoring the mind's role, modern medicine risks overlooking critical opportunities for prevention and healing, limiting its ability to address the root causes of illness. A more holistic approach, one that acknowledges the mind-body connection, is essential for fostering true well-being. One of the most compelling illustrations of the mind's influence on the body is the nocebo effect, the darker counterpart to the well-known placebo effect. The placebo effect occurs when a person's health improves after receiving an inert treatment, such as a sugar pill, due to the belief that the treatment is effective. In contrast, the nocebo effect describes how negative expectations or beliefs can induce harmful health outcomes, sometimes with devastating consequences. As medical doctor Lissa Rankin explains in Mind Over Medicine, the more you focus on the infinite ways in which the body can break down, the more likely you are to experience physical symptoms. Scientists call this phenomenon the nocebo effect. The nocebo effect has been documented in various contexts, from clinical research to cultural practices. In societies where belief in curses or supernatural forces is prevalent, the nocebo effect can manifest in extreme forms, such as voodoo death. Anthropologist Herbert Baisdow provided a vivid account of this phenomenon among Aboriginal peoples in Australia. A man who realizes that he is being pointed out with a magic bone makes a pitiful impression. He is perplexed, his eyes staring at the dreaded bone. He stretches out his hands as if to stave off a deadly force that seeks to penetrate his body. His face turns white and his eyes become glassy. The expression on his face is hideously distorted, like a person suddenly paralyzed. After a while, he recovers somewhat and crawls to his cabin. From then on, he withers away and becomes increasingly ill, refusing to eat and taking no part in any of the tribe's daily activities. Unless there is another shaman to undo the curse, he will die within a short period of time. This stark example demonstrates how deeply held beliefs can trigger physiological responses so severe that they lead to death, even in the absence of a physical cause. In modern Western societies, a related phenomenon known as medical hexing illustrates the nocebo effect's relevance in clinical settings.
Medical hexing occurs when a patient, diagnosed with a serious illness, is given a grim prognosis, such as being told they have only months to live, and subsequently dies in alignment with that prediction. Lissa Rankin notes, "The literature shows that patients believed to be terminal who are mistakenly informed that they have only a few months to live have died within their given time frame, even when autopsy findings reveal no physiological explanation for the early death. This phenomenon suggests that the mind's response to a prognosis can influence the body's survival, sometimes overriding biological realities." Cardiologist Herbert Benson provides further evidence of the mind's power in life and death situations. In an interview with the Washington Post, he remarked, "Surgeons are wary of people who are convinced that they will die. There are examples of studies done on people undergoing surgery who almost want to die to recontact a loved one. Close to 100% of people under those circumstances die." This observation underscores the critical role that mindset plays in medical outcomes, particularly in high-stakes situations like surgery, where a patient's belief in their own mortality can become a self-fulfilling prophecy.
Chronic stress is a pervasive and insidious factor that significantly impacts physical health. Unlike acute stress, which is a natural and adaptive response to immediate threats, chronic stress arises from prolonged external pressures or internal emotional factors, creating a state of ongoing physiological strain. Gabor Mate explains in The Myth of Normal, stress can show up in two forms, as an immediate reaction to a threat or as a prolonged state induced by external pressures or internal emotional factors. While acute stress is a necessary reaction that helps maintain our physical and mental integrity, chronic stress, ongoing and unrelieved, undermines both. Chronic stress is not merely a product of external circumstances. It is deeply influenced by an individual's character, mindset, and coping mechanisms. Traits such as resilience, courage, self-awareness, and the ability to seek wisdom can mitigate the effects of stress, as can practices that elicit the relaxation response, such as meditation or deep breathing. Conversely, a lack of these traits, coupled with maladaptive coping strategies, can trap individuals in a cycle of chronic stress, priming the body for illness. Mate elaborates, over the long term, such a hormonal surplus, as caused by chronic stress, can make us anxious or depressed, suppress immunity, promote inflammation, narrow blood vessels, promoting vascular disease throughout the body, encourage cancer growth, thin the bones, make us resistant to our own insulin, inducing diabetes, contribute to abdominal obesity, elevating the risk of cardiovascular and metabolic problems, impair essential cognitive and emotional circuits in the brain, and elevate blood pressure and increase blood clotting, raising the risk of heart attacks or strokes. Scientific research corroborates these insights. Chronic stress triggers the release of stress hormones like cortisol, which, when elevated over time, disrupt the body's homeostasis. For example, prolonged cortisol exposure suppresses immune function, increasing susceptibility to infections and autoimmune diseases. It also promotes inflammation, a key driver of conditions like heart disease, diabetes, and cancer. Additionally, chronic stress can narrow blood vessels, elevate blood pressure, and increase blood clotting, all of which heighten the risk of cardiovascular events. By fostering a mindset and lifestyle that prioritize emotional balance and stress management, individuals can significantly reduce these risks and enhance their overall health. The way we process and relate to emotions, particularly negative ones such as sadness, anger, fear, guilt, and shame, has a profound impact on our physical health. Healthy emotional processing involves acknowledging and expressing these emotions in a constructive manner, then making necessary life changes to prevent their recurrence. In contrast, suppressing, repressing, or numbing oneself to emotions can lead to chronic emotional distress, which in turn contributes to physical disease. Gabor Mate's The Myth of Normal cites a wealth of scientific evidence supporting this connection. For example, a study at King's College Hospital in London found that women with cancerous breast lumps were significantly more likely to exhibit extreme suppression of anger and of other feelings, compared to women with benign breast tumors. Similarly, research on rheumatoid arthritis has identified a pattern of personality traits associated with the condition, including compulsive and self-sacrificing doing for others, suppression of anger, and excessive concern about social acceptability. These traits reflect a tendency to prioritize others' needs over one's own, often at the expense of emotional authenticity. Such patterns can create a state of chronic emotional repression, which, over time, manifests as physical disease. For instance, suppressed anger can elevate stress hormones, increase blood pressure, and promote inflammation, all of which are risk factors for chronic conditions like heart disease, autoimmune disorders, and even cancer. The physiological mechanisms linking emotions to disease are well documented. Negative emotions, when unprocessed, trigger the release of stress hormones that strain the body's systems. For example, chronic anger or fear can disrupt the autonomic nervous system, leading to imbalances that affect heart rate, digestion, and immune function. By contrast, individuals who cultivate healthy emotional expression through practices like journaling, therapy, or open communication are less likely to experience these physiological burdens, reducing their risk of chronic illness. Trauma, whether experienced in childhood or adulthood, represents another critical pathway through which the mind influences the body. As Gabor Mate notes, trauma is about what happens inside us and how those effects persist. Traumatic experiences can lead to profound mental and emotional states, such as fear, guilt, shame, depression, and self-hate, that wreak havoc on the body. A study conducted at the University of Toronto found that men who experienced serious childhood trauma were 3 times more likely to die from a heart attack, even after controlling for other risk factors like substance abuse. The impact of trauma is mediated through the mind's response to the event. Unresolved trauma can lead to chronic activation of the body's stress response, resulting in elevated cortisol levels, immune suppression, and inflammation. These physiological changes increase the risk of a wide range of conditions, from cardiovascular disease to autoimmune disorders. Moreover, trauma often shapes an individual's mindset and emotional patterns, leading to maladaptive coping mechanisms, such as emotional suppression or avoidance, that further exacerbate health risks. Importantly, Recognizing the role of trauma in illness is not about assigning blame. Many traumatic experiences, particularly those from childhood, are beyond an individual's control. Instead, understanding trauma's impact empowers individuals to address its lingering effects through therapeutic interventions, self-reflection, and other healing practices. By processing trauma and cultivating a healthier mindset, individuals can mitigate its long-term effects on their physical health, paving the way for recovery and resilience. While the mind can contribute to illness through negative beliefs, chronic stress, and unresolved trauma, it also holds immense potential for healing. Just as harmful thought patterns can undermine health, positive beliefs, emotional resilience, and a healthy mindset can foster recovery and well-being. Lissa Rankin poses a thought-provoking question in Mind Over Medicine. What if the key to health isn't just eating a nutritious diet, exercising daily, maintaining a healthy weight, getting 8 hours of sleep, taking your vitamins, balancing your hormones, or seeing your doctor for regular checkups? What if you have the power to heal your body just by changing how your mind thinks, your heart feels, and your life force flows? The placebo effect is a powerful example of the mind's healing potential. By fostering positive expectations, the placebo effect can trigger physiological changes that promote recovery, even in the absence of active treatment. Similarly, practices such as meditation, mindfulness, and cognitive behavioral therapy can reduce stress, enhance emotional resilience, and improve health outcomes. These approaches work by activating the body's relaxation response, reducing cortisol levels, and promoting a state of physiological balance that supports healing. Moreover, cultivating a mindset of hope, self-compassion, and empowerment can enhance the body's natural healing mechanisms. For example, studies have shown that optimism and a sense of purpose are associated with better cardiovascular health, stronger immune function, and faster recovery from illness. By fostering a positive mental and emotional environment, individuals can tap into the body's innate capacity to heal, complementing traditional medical interventions. The mind-body connection is a powerful and undeniable force that shapes our health in profound ways. Negative thought patterns, chronic stress, maladaptive emotional processing, and unresolved trauma can contribute to the onset and progression of chronic disease, while a healthy mindset and emotional resilience can foster healing and well-being. As Gabor Mate writes, no matter how sophisticated our minds may be, the fact remains that their basic contents, what we think, believe consciously or unconsciously, feel or are prevented from feeling, powerfully affect our bodies, for better or worse. Recognizing the interplay between mind and body is not about blaming individuals for their illnesses, but about empowering them to take an active role in their health. By cultivating self-awareness, emotional authenticity, and resilience, individuals can harness the mind's potential to heal the body, paving the way for a vibrant and fulfilling life. This holistic approach, which integrates the psychological and emotional dimensions of health with traditional medical practices, offers a path to true well-being, enabling us to live in greater harmony with our inner selves and the world around us.